Some medications specifically target the dopamine system. How do you use supplements to actually get off some of these medications? When it comes to mental health, I think it's important to take a targeted approach to how you deal with it. Because to be frank, I mean, a lot of people have tried medications or are on medications. So how do you supplement for it? Or how do you even go about getting off some of these medications? How do you use supplements to actually get off some of these medications? So there are multiple brain hormones involved in dealing with depression or anxiety. Most of the medications that we're talking about deal with serotonergic, which means low serotonin. However, some medications specifically target the dopamine system. And so I have Mood Boost is our product that really helps target people with serotonin problems that have taken the what we call SSRIs or SNRIs, those medication, and it's helped them a lot. And they're trying to get off of those, or then they will take Mood Boost to support while they're trying to wean off those medications. But I'm here today to talk about Dopa Balance, and Dopa Balance is cool because it deals with the dopamine system. And the dopamine system, I think about it as what are some of the diagnoses or symptoms that's related with low dopamine? It could be depression, but also ADD and autism spectrum. People with ADD, ADHD sometimes can have issues with lower dopamine levels. And when I think about depression, that has to do with more dopamine. When dopamine is high is when you're on vacation. So it's just this innate sense of like joy that you have. Dopamine gets very high when we're on vacation, when we're having fun, super relaxed. It's a different hormone that supports our sense of well-being. And it tends to be low in individuals who have ADD, ADHD, and it tends to be low in individuals who've taken the medication Wellbutrin. So if you've taken the medication Wellbutrin and you felt like it really did help you, you have low dopamine. So that's like one of those clinical indicators that helps you choose a supplement that's really right for your mental health. If you've taken Wellbutrin before, then Dopa Balance would be really right for you. I think about the ingredients that are in Dopa Balance, and they're all ingredients that are like the N-acetyl-tyrosine is a precursor to dopamine. So why not take a precursor? And then there's also Mucuna extract. Mucuna extract contains L-Dopa, which actually is dopa, basically precursor to dopamine as well. And then there's a little bit of green tea extract in there and a little bit of quercetin in there. These are cofactors that are super helpful to help you make more dopamine as well. So I would say that Dopa Balance, what I would do with it is I would take about 2 in the morning would be a great way to take it. If you find that you can go up to 4 a day if you needed to, but if you find that you would rather take it at night, it's not like it's a bad thing. Most people do take the Dopa medications in the morning and supplements. So I would say 2 of the Dopa Balance in the morning is great. If you find that you have some benefit, but you want to increase the dose, then I would take 2, just take it twice a day. Most people, all they really need is 2. Now, some people will take this supplement so that they're able to feel better and do better. And once they do, they then start weaning down on Wellbutrin. So that's really something you should discuss with your provider and work with the provider on. But some people will take Dopa Balance to help them feel better. And it's as a means to also wean off the Wellbutrin medication as well. So that's a great option for a supplement choice if you're dealing with depression, ADD, ADHD.